everyone. Welcome to our webinar, COVID-19 and K-12 Response. We know this is a challenging time, and we appreciate you joining us for this webinar today. My name is Sarah Porter, and I'm the Vice President of External Affairs at Healthy Schools Campaign. Today, I'm representing the Healthy Green Schools and Colleges program, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning programs. Before we begin, I'm going to quickly review some basics for today's webinar. Today's webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website by the end of the day. We're going to save the bulk of our time today for a question and answer session with our committee members. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. COVID-19 has thrust school custodial teams into a frontline battle with infection control and forced leadership to quickly develop and implement processes to address this global pandemic locally. The Healthy Green Schools and Colleges committee members graciously offered to share their experiences dealing with COVID-19 in their K-12 districts.
Hi everyone, we're sorry that we're scrambling a little bit with loss of internet. Mervin, are you there? Looks like Mervin.
Yeah, I'm here.
You know, Mervin, so Tia, if you can fast forward the slides to Merv's first slide. And Merv, I'm going to ask you, why don't you introduce yourself and why don't you get started? And we will, if Sarah comes back, we can backtrack, but in the meantime, let's not wait. I'll say, because I've known Merv for years, Assistant Custodial Supervisor at Salt Lake City School District, a great guy, part of the Green Clean Schools Leadership Council since its original foundation. And Merv, why don't you tell everyone about what you've been working on?
Okay, thanks, Mark. So our school district is about 26,000 students. We have a total of about 42 facilities with some of the charter schools, the administration, warehouse, all that kind of stuff. What we have been facing this season, well, let me backtrack a little bit. We have put in a protocol, a cleaning and disinfecting protocol that we have had in our department for over 3 years now. And it is one that is 3 different levels, kind of a daily cleaning and sanitizing. If we feel that we need to up that just a little bit, we do. We go to what we call a yellow alert, which is we increase the frequency in some of the high traffic areas, and we also would increase the ppm in the chemical that we use, and I'll get into that in just a minute. And then we have what we call outbreak control, which is our red alert. And our outbreak control is if there's any kind of whether it's a norovirus, a bunch of kids with the flu, anything like that, that is what our red alert is. And the only difference between that and yellow alert is that we more frequently hit the high communal areas, the more common touch points. Instead of a couple of times a day, it's almost hourly. So that's really what our protocol has been. Our protocol uses, for the most part, uses hypochlorous in its as a sanitizer. So when all of this hit, for us in the Salt Lake City School District, I hate to say it, but it was kind of business as usual, because all we do is send an email to our custodians reminding them that, hey, we need to step up to the next level. Keep in mind that they receive annual training. Keep in mind that they receive, along with the emails of let's step things up, a reminder of what those protocols are, as well as we have a YouTube-based online training that they can access anytime, anywhere. So it's very simple for them to be able to know exactly what the protocol is at any given time. With that said, we believe in using two different chemicals. One, well, actually we have three different, but our primary sanitizer is hypochlorous. We have on-site generation that we use, as well as the tablet form that many of you are aware of. However, because we like to be redundant, we also have what we call backup chemicals. So many people I've heard when this hit, they gave up their green cleaning chemicals and moved directly back to quats and other things. Well, we didn't have to do that because our backup chemical is hydrogen peroxide-based cleaners that one of them does carry a virucidal claim. When the list came from the CDC and from the EPA, this list had certain emerging viruses, emerging pathogens, I guess it was, list. And on that list are several products that were approved to take care of all of this. So we went down that list, and guess what? Our primary chemical is on the list already. The secondary chemical that we would use is on the list already. Our custodians went into, our schools were put on a recess, a 2-week recess. Our custodians went into a deep cleaning mode, something like you would say spring cleaning or even summer type cleaning, while the students were not in the building. And that was really the only change for us. Now school has been put on another 5-week recess till May 1st, and our custodians are just moving into summer cleaning, regular summer cleaning. The buildings themselves are locked and closed, so it's just our custodians in there doing their work. There was a question that came up from the superintendency, how are our supplies? We are good on supplies. We make sure that we are deep on supplies because we always anticipate the need for a month or so of having to have a stockpile of supplies like that. And I also brought to our superintendent's attention that as far as sanitizer goes, we on-site generate. So as long as we have water, as long as we have electricity, we can make sanitizer until St. Switham's Day. We're good. And so as far as our people now, our contract custodians, our full-time custodians are all working as normal, and they are doing the cleaning and sanitizing and things that they should be doing. The part-time people are being brought in to assist with that, we are including the play equipment outside. Just because we don't have school inside doesn't mean the neighborhood isn't coming over and using the outside play equipment. So our people are also cleaning and sanitizing according to the CDC guidelines, the way the CDC says to do it. We are taking care of the outside play equipment as well. So how it's affecting our people is a current, maybe they have to change their shift. That's about it.
Thank you, Merv, for sharing. And I, again, apologize to everyone for the technical glitch we had earlier, but thank you, Merv, for sharing all of that. We'll definitely hear more from you in a bit when we get to the question and answer session. And next, I would like to introduce Shawna Cragun from Davis School District in Davis County, Utah. Shawna?
Thank you. Again, I'm Shawna Cragun. I'm the Director of Custodial Services for Davis School District. I've been in my position for 6 years. Just to give you a little bit of background on Davis School District, we have 11.5 million square feet of internal space, 104 buildings with 96 of those being schools, 8,000 staff members, and about 73,000 students. The current situation in Utah is on a soft closure of all schools. I think that soft closure looks differently for every one of the districts, but for Davis, what that means is we're providing education and breakfast and lunch to students. That education is, of course, online, digital. most of our personnel that have the opportunity to work from home and they can successfully do that, we've requested that they do that. Our teachers have been put on A and B days if they cannot work from home. So, they'll come in and work Monday, Wednesday, and Friday. We are really pushing social distancing for custodial employees. Essential personnel are working altered shifts. They're working in separate spaces, pods, buildings. We're not doing any team cleaning at all. We, similar to Salt Lake School District, have several different phases. We have 4 in Davis that we practice. And like Salt Lake School District, we disinfect every single day. We have a very good protocol that protects against viruses that we feel very comfortable with. But we stepped up to our second phase probably about a month ago. And for us, that means we only vacuum 1/2 of the building every day. We spend the extra time saved really focusing on those sensitive touch points that are so critical for us to disinfect. And we work tirelessly on those. We'll go rotating through because we do have people in our buildings. For us, disinfecting is really, really critical. So like I said, we're pushing social distancing. We're holding all of our employees financially harmless. If they cannot modify their schedule to work within the parameters that we are asking them to, we have promised to pay them. And I think that's put a lot of them at ease and really helped. As far as the coronavirus specifically in Davis County, right now we've had 1 death and we have 29 active cases. We have had no exposure in any of our schools. We've had no proven contamination in any of our schools at this time. We are very closely following the CDC's recommendation for disinfecting, as well as for social distancing and those types of things. As far as what we're doing with our employees, we are working with all of them as individuals. I have 665 permanent employees, and honestly, all of them are in a very different situation. If I have one that has upper respiratory issues, they're in the age category that's concerning, and they don't feel comfortable coming to work, I'm going to pay them to stay home. We want our employees to feel safe. We want them to feel valued. We don't ever want them to feel like they're being put in a situation. We've got great protocol. We feel like everything that we're doing is very, very safe, but we always want to take their peace of mind as a top consideration. So we've had modified schedules. If they can't modify their schedule, I'm paying them. But if they can work within the parameters that we've outlined, we've asked that they do that. As far as supplies, very similar to Salt Lake School District, we own several electrostatics. We have hypochlorous product that we're using to disinfect schools. We went in January and did a mass purchase of hypochlorous, anticipating that we may be in the situation of needing to spray every single one of our facilities repetitively throughout the day for several months. So we, as far as supplies and materials, we're in a very, very good place. But again, we've really pushed the social distancing. We're not having people take lunches together, all of those types of things. But we're wanting to make sure that people know that we're here to support them, and we want to make sure that they feel comfortable being at work.
Thank you, Shawna. That's amazing that you're able to do that, and I know that not everyone is quite in that same situation, but it's wonderful to hear what your district and you've committed to doing for your staff. Next, I would like to introduce Tony Almeida from Elk Grove Unified School District in Elk Grove, California. Tony?
Good morning or good afternoon to everyone. My name is Tony Almeida. I'm the Custodial Manager for Elk Grove Unified. For those of you that don't know where that is, we are here in California. We're the 5th largest school district in the state, with approximately about 63,000 students, with about 74 buildings, 67 of them actually a combination of middle, elementary, and high school. We cover about 320 square miles, of area, and approximately roughly about 287 permanent custodians and roughly anywhere between 40 and 70 active substitute employees. So our situation is a little different, and I think Shawna talked about it earlier, depending on where you are around the country and how COVID-19 has affected you guys. We were probably one of the early adopters of a complete district shutdown. I want to say, and I don't know the exact day, but it was either the first or second week of March, our superintendent and board passed that we close our entire district. And at that time, it was just precautionary as the coronavirus was still ramping up. So after we addressed a lot of the community uproars, because we had championship basketball games, I mean, it was something that you don't live and see every single day. So right now, currently, we have no custodial folks working and have not worked since the middle of March. What we are actively doing at the moment is supporting our food and meal services plan with our food nutrition services. So because of our reduced lunch and free lunch programs, we offer food and meal services to the community at 34 of our schools. So our custodial staff, as part of being an essential function of operations, they are supporting the meal services plan at 34 schools. However, we are not deep cleaning because of shelter-in-place ordinance that was issued by the governor. So currently, there is no school in session. We're closed until further notice. I would be surprised if we do open after traditional spring break, but things change daily and even hourly. I'd like to talk a little bit about our supply chain. So we traditionally, we have a central warehouse here. So we have a constant stockpile of toilet paper and paper towel, garbage bags. We also have a secondary product that we use to clean and sanitize. It's hydrogen peroxide-based sanitizer. And we also use on-site generation, both the hypochlorous end and the aqueous ozone end. We traditionally, because of trying to maintain inventory, we try to always have at least a 30-day supply of the necessities, gloves, masks, and liquid electrolyte for our on-site generators. During the shutdown, the week, because we didn't know when school was going to reopen, as this was pretty new to everybody, we ramped up our touch point cleaning earlier on. So you can imagine the challenge of trying to get 300 people to focus on touch point cleaning, because a lot of the information at the time regarding COVID-19 was still new. Currently in our area, we have, and it changes hourly, we have anywhere from 80 to 100 confirmed cases and 4 deaths. The deaths were, of course, folks that had already an underlying health issue, were over 70 years old. We did, however, have one student that tested positive for COVID-19 that prompted the shutdown, I would assume. And so right now we're still living and learning as we continue through this progress. We practice cleaning for health every single day. Usually right around October, we start communicating with our staff to let them know to ramp up the touch point cleaning. Again, a lot of lessons learned over these past few weeks, and I think one of our biggest challenges that we've learned was to maybe we need to revisit an emergency response plan or infection prevention plan that we can legitimately follow and practice.
Thank you for sharing, Tony. Appreciate everything that you were able to share with us in your experience, especially being out there in California where some of the earliest wave of this really hit. Lastly, I would like to introduce Mike Jones, Director of Custodial Services at Columbia Public Schools in Columbia, Missouri. Mike?
Thank you, Sarah. We're a K-12 school district. I've been in the district 17 years, 5 years in my current position as Director of Custodial Services. We have around 19,000 students, 40 district buildings, 3.5 million square feet cleaned, about 170 custodial staff. Really, this is our week of spring break. Last Tuesday, the district made a decision to end school immediately, send all students home as that being their last day. Teachers were supposed to organize all their literature to teach online and be home no later than the 13th, last Friday. Custodial staff is considered essential employees. We are still in our buildings right now cleaning and disinfecting. So there's really been no change there. Prior even to the 17th, which was, I think, was really important, actually 2 weeks prior, I was meeting in high-level meetings with key district staff members. What are we going to do if this hits? Are we prepared? I already had an emergency response plan. However, it was for other viral things, coronavirus thing, or different viruses. I just needed to update it. So everything pretty much was set in play. I did provide that to all of our district superintendents and principals to sort of give everybody a sense of calm. Another thing that I developed was a checklist for all spaces in the building, and that's for when the teachers do come back. We're shut down, school shut down until I believe the 13th of April. When they come back, they can go into their buildings and see all of these things were cleaned in their classroom, and that was something I thought that was very important. We kind of every day is a different day. We have about by the way, we're halfway in between Kansas City and St. Louis, right in the middle of the state of Missouri. University of Missouri is our largest employer here. They are completely shut down. We are continuing on right now. Kansas City, St. Louis are getting hit a lot worse than us. We have about 20 confirmed cases in Boone County. There's only one case that hit one of our school districts, and that was a teacher. That building's already is in the process of being cleaned, and we're moving forward there. Cleaning chemical wise, we do have on-site generation. However, I learned that our unit is not effective against emerging viral pathogens, so I had to scramble a little bit. Luckily, I'd been since December, January, been bringing in 3 different companies. We've been testing their chemicals and disinfectants and everything else, and so we had a pretty good supply of cleaning chemical that is effective against the emerging viral pathogens. I think that's about it for now.
Thanks, Mike. And thank you all, our committee members, for spending your time with us today and sharing your experiences with us. Before we move on to the Q&A session, I do want to mention that the information shared during this webinar is for general informational purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you're seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge sharing event in which these leaders of the green cleaning and building operations in K-12 districts have shared their experiences. Now we'd like to open it up for a Q&A session. To help us with that, we have Mark Bishop, another committee member, who will be directing the questions during the session. Mark?
Great, thank you so much. Please, everyone, type your questions in. We're going to try to get to as many as we can, but let's just get right onto it. So I'm going to start with a question from Merv. So a couple of points, a couple of people asked for a little more details on what's going on. I think you might have said that you were closed, your schools were closed for 3 weeks and 5 more weeks. Can you confirm what's going on in the schools and how many students have been reported of being sick, infected? And then finally, related to that, sorry, Merv, I keep talking. What does it take from your school district's perspective to become I think what you said was red alert? So who calls that red alert? What makes you kick in that new protocol?
That's a great question. So let's see, try to remember the order that those were asked. To our knowledge, we have had, because that hasn't all been shared with us, but to our knowledge, we have had 0 cases of COVID-19 in our students. There was the Utah Jazz. Remember, they were kind of the whole thing that started all of this. Was a couple of Utah Jazz players had been tested positive, and keep in mind that those folks work very closely with a lot of school children in a lot of different programs, and so there was concerns that some of the students may have been exposed, and of course, they were quarantined and whatnot. Again, we've had no confirmed cases in all of that. So what was the next question as far as that went, Mark? Sorry.
The questions were related to the number of students, and then what does it take for red alert to be initiated, and whose responsibility is that?
Okay, so that's a very good question, and I'll be very upfront on that one. The custodial department watches the custodial leadership. We have a team of 3, myself, Ricky Martinez, and our supervisor, Robin Anderson. The 3 of us make one team that is very vigilant in what goes on in our department. And as we get reports from either our custodians or from the school nurses, but I'll be honest with you, our custodians are on top of things and will let us know, hey, we've had X number of cases of, the cruise ship virus. I can't think of the name of it now, but we've had so much, norovirus, or a confirmed case of norovirus, or there's been 15 kids out in room 12, something like that. They are very vigilant on that. They'll let us know, and we just remind them, okay, so you know what the protocol is, step it up to level number 3. They will tell us we're already on it. So who calls that? I guess if you had to look at it that way, we as a custodial leadership team, but quite honestly, our custodians are well enough trained and well enough on top of it within their own buildings that as they are aware of things going on around them, they usually step that up on their own. But if they need that reminder, it comes from us.
Great, thank you. I'm gonna keep plugging through. The questions are starting to pour in. So I'm just gonna I'm gonna ask most of the questions to just one person to keep this quicker. But if we can get more perspectives, we're gonna give it a try. Let's start with Shawna. Could you give a slight deeper description of the different cleaning phases that you use and when you use one versus the other? The question about I'm going to ask this question of everyone is, are you willing and able to share your different protocols and phases with the participants of this webinar? Shawna?
So first of all, I am willing to share anything I have with anybody who would like to have it. If I have data, or if I have spreadsheets, or if I have anything, and whether that be protocol or otherwise, that people feel that they could use and that would make them more successful, I would be more than happy to share that with anybody who requests it. As far as the different protocols, so our first step is just our daily standard disinfection. We focus on regular touch points. We clearly disinfect all of our bathroom surfaces, everything like that. I think the standard of what everybody does. That's our first step. For us, our second step would be we take a facility, we divide it in half, and we vacuum half of the floor surfaces every other day. So on A days, we'll vacuum the west side. On B days, we'll vacuum the east side. And we spend that extra time focusing more heavily on student desks, computers, computer mice, lockers, touch points that we focus on as a regular process, but that we want to really hit very, very regularly throughout the day. Sometimes we'll be disinfecting, doorknobs 5 and 6 times a day. If we have but this is my kind of stance on it. If we didn't have anybody in the building and we could disinfect a room and lock the door and not worry about it being contaminated, that would be great. But if we've got one person that's been in that area, it needs to be disinfected again. So for us, our third phase would be when we have an actual concern in a building. And like I said, we haven't had any confirmed cases, but we have had someone, call and say, someone in the building is sick. Please come in. We're really worried. Then we will go in with our electrostatics, our hypochlorous, and sweep the entire facility. A lot of that has to do with being really thorough, but a lot of that also has to do with peace of mind and putting people at ease and making them feel comfortable in their workspace. We definitely have the ability, if we had major concerns, that we would sweep all of our facilities regularly throughout the day with electrostatic and hypochlorous. But we would rather not do that unless we're in a situation where we actually have some type of contamination. But there's always additional steps. I think that for Utah, like Merv said, we are in a soft closure, meaning that students are not in buildings, and that's been extended until May 1. I honestly don't anticipate we'll see students until August.
Okay. Thank you, Shawna. Let me ask the next question of Tony. This actually piggybacks on what Shawna, one of the comments that Shawna made. And it has been asked by in a couple of different ways by a couple of different people. So Tony, what are the protocols that you have in place about reopening your building when you're ready, when things are done? Do you keep your building on lockdown? Do you ask people not to re-enter specific rooms? Do you just keep the cycle going? So essentially the maintenance of the building as is, and how to make sure that you're keeping it clean.
So I guess to be politically correct, I mean, we do the best we can each and every single day, and I know it can vary based on logistics throughout the country and custodial staffing and your formulas. I mean, it really does vary, and unlike others, our schools are heavily used with after-school events. For example, we have 30 of our schools that offer a dinner program. So obviously the MP room and restrooms are going to have to be re-cleaned again. So trying to go back and do all of our high touch point cleaning, we're going to have to be flexible on how we approach it. Like Shana stated earlier, I believe, vacuuming half the campus or dividing the campus in quarters and focusing touch point cleaning on certain zones throughout the week. That is what we try to do, but the amount of activities with after-school programs really hinders us from trying to do the best we can. I think Shawna said it earlier too, if we were able to do a once-over and go and do our touch point cleaning and do our vacuuming and just literally close the door and then go back and do our hydrostatic spraying and misting of all rooms, the students' educational life would be extremely well But unfortunately, reality kicks in, so we have to be extremely creative with our workflow.
Okay, thank you, Tony. I'm going to ask another question that has been asked a couple of different ways in a couple of different using different terms. Mike, there's been a lot of conversations about on-site generation and what that means. So let me, can you speak to hypochlorous acid, on-site generation, and how that is being used, and the the practicalities of that from your perspective?
We've tested years ago. We brought in engineered water back in 2013, 2014. You got units that produce hypochloric acid, basically, units that are aqueous ozone. I'm not going to tell you whether these are effective or not. I will tell you that the units that we have, I received an email from the manufacturer saying, just please keep in mind these are not approved for emerging viral pathogens. So if you have those units, I would definitely get with your manufacturer and get proper documentation that those units are actually will work and combat this virus. I thought mine was, and I found out later it wasn't. Lucky for us, we do keep, we provide our nurses with a different disinfectant that is effective against bloodborne pathogens, and we keep a pretty large stock of that in, so we have that as a backup. And as I think I mentioned earlier, we were in the process of testing various different cleaning chemicals, so we had a supply of that in our buildings to make sure that we are properly disinfecting our buildings. So I think I answered that about as best I can.
Okay, and that raises a question that I'm going to bring up about school nurses. But before I move on, Merv, I know that you are using on-site generation. What is your perspective? Have you heard the same thing about on-site generation and the use of disinfection or sanitizing and the difference between the two?
I have not heard anything as far as the on-site generators. I have not heard anything as far as that. The big problem is, of course, that whole, they fit into a different category with the EPA, and so getting them certified is very difficult. However, the tablet form of the hypochlorous that we use is on the emerging pathogens list, which is awesome. And our method of delivery on that is, well, we have two methods of delivery. One is, of course, wiping things down, which is your number one protocol. And number two is we use electrostatic spray to, as a secondary, as a backup with that. But as far as the on-site generation itself, no, we're not aware of anything that is, how can I put it, certified on this particular thing. But we do know that it's a good, quote, sanitizer. And of course, thinking of how the CDC has this, your first level is basically cleaning, you're wiping. So using a sanitizer at that point is actually not a bad idea.
So just to clarify, what you're suggesting is the on-site generation you're using as a cleaner and a sanitizer, but as a disinfectant, you have other options, which is going to get a much higher kill claim, which is really what we're aiming for this type of outbreak. Is that correct?
Correct.
Okay,
correct.
Great. Let me. I keep having a lot of questions. I'm going to circle back to a question before I talk about school nurses. There was a follow-up requested about having someone on the call has their facilities are closed for a foreseeable future and they're not being used. I'm just going to open this up to whoever has a perspective on this. If your school is not being used and you're not doing evening programs, is there an appropriate protocol for reopening the facility once it's been cleaned and disinfected and it's not being used and it's laying lane unused.
This is Shawna.
Go ahead, Shana.
Thank you. I would just say there are requirements on the CDC website as far as what classifies a building as decontaminated or clear. I think that as long as you follow those protocols and then the space has been locked up with no access, then you could just reopen it. But I think if there has even been one person in there, the entire protocol from the CDC needs to be followed again. But that is just my personal take. Thanks.
Okay. Great. Thank you.
Go for it. This is Mike. I'll just add something really quick. Our buildings are shut down for teachers, students, staff. There's nobody in our buildings but custodial besides our administration building, and that's only a couple areas, payroll, business office, IT department, because everybody else is basically working from home. So when our custodial staff enters a building, the one thing that I made sure we did is we're starting from the farthest point in the building. So if you've got a 2-level building, you start on the very farthest point outside. You sanitize and disinfect the rooms. Those rooms are locked and shut down, and there's a note checklist on that door saying it's been cleaned and disinfected. And we're going from the farthest point to the main entrance, and that's kind of how we're tackling it. So we know that those spaces have not been re-entered. I do believe teachers have been told do not come in, and key fobs have been turned off, so they cannot come into the building.
Yeah. Okay. Thank you. Next question, school nurses. Let me ask Tony about this. Have you engaged with your school nurses to support communication with teachers, with staff, to be part of the disinfection team, whether it's about understanding of the protocols or just as a important communication member of your team?
So that's funny you should ask that. That's a great question. A couple years ago, when we had, I want to say it was MRSA or the H1N1 outbreak, just like anybody else, and again, we're probably the last on the list, we would traditionally get calls from teachers, nurses, principals, all for the same reason. We have sick kids here, we need to have a deep clean. So in order to kind of streamline that process, we worked with our student and health support services department. So we've devised a communication highway or a path that we formalized with our health department at our school site. So when there's a communicatable disease, and it can be hand, foot, and mouth, it can be pink eye, it can be just about anything, we established a program where the site nurse would reach out to our health and support services division and report the problem, and then from there we would receive an email from one person, and it goes to one person in our custodial management department, and from there it's shared with a team that works out of the maintenance and operations department. So we respond to these communicatable diseases same day. We go in there and provide more of a clean and sanitize. We shampoo the carpets. We want to kind of eliminate every possible avenue to kind of reduce the risk for any other students. And so that's a communication path that we developed a few years ago, because it got pretty crazy and intense when you get 17 phone calls for the same thing. So that is a procedure that we're proud of, even though it's a small procedure, but it really did help our functionality and our process moving forward.
Thank you. The next question I want to bring up is about PPEs, personal protective equipment. I'm going to ask Merv. Merv, what type of PPEs do you offer, suggest, require of your staff during this outbreak?
That is a lovely question. So the chemicals that we use, we follow the label is the law, as with any EPA registered product, the label is the law. Follow the guidelines for recommended PPE. With that said, the chemicals that we use do not usually require much in the way of PPE. However, all of our custodians are always provided with nitrile gloves. They are provided with safety glasses, safety goggles, whatever you want to call them, for anti-splash type of things. And we also offer and suggest that they wear the dust, and they're just a dust mask. They're the same thing you would use in burnishing a floor, anything like that, simply so that we can reduce any type of aspiration, even though these chemicals are very safe. Okay, they do not carry any aspiration, problem areas, but we do suggest that the employees wear those just in case, because we always want to provide the highest level of PPE we can, go above and beyond what is recommended, in other words.
Okay, very good. Thank you. Let me go to
Mark?
Yes.
Sorry, this is Shawna. I would just like to throw in really quickly. If you're cleaning an area that has proven contamination, the CDC also recommends that you wear a gown. That's specifically in regard to COVID-19, but that is part of the CDC requirements or recommendations cleaning a contaminated area. So I just want to make sure everybody's aware of that also. Thanks.
Great, thank you. Let me get another question, very specific. I'll ask this one of Mike. How do you disinfect technology such as keyboards and computers?
Oh, wow. Because that's not normally our responsibility, because teachers' desktops, they're off limits to our staff. Computer labs and stuff are done typically by the media specialists, but during my meetings with the high levels of Columbia Public Schools, I brought that question up to the director of our instructional technology and said, hey, by the way, we're not doing this because this is what we've been told, because we may damage those keyboards and mouse. She said, absolutely not. That's not going to hurt anything as long as the computer's turned off. Mm-hmm. So based on their instruction, an email was sent out to all district buildings saying custodial staff effective immediately will be cleaning keyboards and the mouse in the area around that on the teacher's desk. It's their responsibility to turn those off. And we're following the same guidelines as, one of our disinfectants that only has a health rating of a 1. We are saturating the board and letting it sit there for 3 minutes and to reach the full kill claim, and the same thing with the mouse. So and then we're using microfiber rags to clean those surfaces. Just keep in mind that that area has to remain wet for the amount of time of the kill claim for the sanitizer or disinfectant that you were using.
My quick follow-up, are you talking about, do you use electrostatic sprayers? Do you use microfiber cloths to apply disinfectant? How are you applying disinfectant and ensuring clean keyboards and technology?
We're also doing the telephones as well. Sorry. No, we're spraying it directly out of a spray bottle. We do have a couple electrostatic sprayers. The market on those right now, it's almost impossible to get, and the price is well over doubled. So, but after we have sprayed and allowed our chemical to sit for 3 minutes, we are using microfiber rags to wipe those surfaces. And you got to really follow the rule of replacing those microfiber rags as frequently as possible.
Mm-hmm. Great, thank you. I want to make one note, and then I'm going to ask my final question. I apologize to all the participants if we haven't gotten to your questions. A lot have come in, but I feel like there's been a great discussion so far. In our previous webinar, one of the panelists mentioned that they could not source any electrostatic sprayers, and they ended up purchasing from Home Depot paint guns. And they put products in there, and they found it to be very effective in a very similar way to electrostatic sprayer. Take that information as you see fit. Let me ask one question. And actually, I will mention one thing. As I say that, somebody said, please encourage folks to check antimicrobial labels for application methods, because EPA does not recommend using application methods that are not described on product labels. Absolutely appropriate. Thank you for bringing that up. Last question for everyone. I'm just going to go one at a time. We've talked about disinfection for years. It's always an important topic for everyone, but never have we been in a situation like this before. And I'm sure you all have learned a lot in trial by fire. So I would like everyone to tell me if you have one lesson learned that you wish your younger self would have known. So your younger self of 4 weeks ago, what do you wish that younger person had known that you know now and that you could have done a little differently or a little better? I'm going to start by throwing Merv under the bus and asking Merv to go first.
So if I had to go back 4 weeks, I couldn't tell you anything. If I had to go back into my further career, what I would tell my younger self is, look, you as a custodian are the front line. You are extremely important, extremely valuable, and you need to learn everything you possibly can personally about your profession and the importance of what you do and how that affects human health.
Okay. Thanks. Shawna, your turn.
You know, I think 4 weeks is not long enough, but if you said go back 12 weeks, what would I do differently? 12 weeks ago, I probably would have bought 50 more electrostatics. I have a very, very good stockpile of them. I probably have 40, but again, I have 104 facilities. We can make it work, but I would really like to have more. That's the one thing that I wish I would have known.
Great. Tony, what do you wish you had known?
Well, again, I'd probably go beyond 4 weeks. If I had to do this all over again and to prepare myself in our district, would be to establish some basic guidelines on just everything we do: classroom cleaning, an infectious prevention plan, a response plan, something that we can reference and practice it, kind of like a fire drill. We practice a fire drill once a month or twice a month, but if you don't do anything with practicing any type of procedural that you have in place in the custodial, then it's just going to get lost and people will forget. So I would develop procedures and policies, even basic, so that way when things are the way they are around the world, you're better prepared and planned for.
Thank you. And Mike?
I think if I went back, I would probably have thought better about how I'm going to respond to my custodial staff, teachers, district staff, really to kind of send the signal of to remain calm. You know, you get one brand new case in your county or your city, and everybody gets more and more on edge. And how you respond to that as, you know, the director or however is so important. We, you know, just real quick, we did pay all of our custodial staff their normal hours plus time and a half worked. And that showed a strong signal that we really care about them. So if they want to stay home, they can stay home. If they want to come to work, this is how we'll compensate you.
Great. Thank you all so much. Sarah, I think it's time for me to give this back to you.
Thank you. We want to, at this time, take a moment to thank the sponsors of our Healthy Green Schools and Colleges program, including Platinum Sponsor Diversity for their continued support, and all of our sponsors for their longtime support of the program. This work would not be possible without them. Thank you again, Merv, Shana, Tony, and Mike today for making time for this important discussion. And Mark, thank you for helping field our questions. Thanks to all of you for attending. Please contact Dion Glasser, the Program Director of Healthy Green Schools and Colleges, with any questions. She is not able to join us today, but her contact information is listed here. We will also be using some of the themes that emerged from today's webinar to inform our webinar on March 26th, COVID-19, school response, and operationalizing CDC guidelines. This webinar is for both higher education and K-12 schools. Please join us if you can, or register to receive the recorded webinar. And just a reminder that we will be sending out an email with a link to the recorded webinar today and links to several of the resources mentioned during this webinar, including some of the things that the speakers had offered to share. Again, thank you so much for your time. We appreciate your participation and your time with us today. Have a great day and stay well.